Hi, we're here at HIMSS 2017 with Dr. Venkatesh of Aravind Eye Hospital. Thank you for being here, Doctor.
Thank you.
We'd like to hear a little bit more about this innovative project.
So Aravind, 40 years back, was started with a single mission to eradicate needless blindness. So we wanted to reach the people who could not be reached. Basically, we call them the non-customers who don't come into your hospital. So we did a lot of outreach activities in the form of eye camps to reach people who could not be reached. And over the years, we did a study to see how this worked. And interestingly, we had a data which showed only 7 to 10% of people who needed eye care utilized that.
Wow.
So at some point we thought we should start something more permanent in semi-urban rural areas, and we created this primary eye care centers or vision centers, wherein we are continually improving the quality, and this particular project involves putting a fundus on phone.
Okay.
So to take retinal images, which is again sent through EMR to the base hospital for telemedicine consultation.
Wow. And what was it that motivated this project for you?
Constantly we're looking at improving the quality of these primary eye care centers.
Right.
Because of the limited resources and facilities in rural areas. But now with the availability of information technology and good internet services, we are able to use mobile phones.
Sure.
And the low-cost technology to image the retina.
Wow.
So these images can be very comfortably, can be transferred through the electronic medical records, through the broadband connectivity, and the doctor can take a very good decision whether to refer the patient or to maybe take care of them in the vision centers.
Wow, great. And I understand this project didn't require an enormous budget. So could you tell maybe us a little bit around 3 tips for doing great things where you might not have the world's biggest budget?
Yeah. See, actually, if you take cost, the cost involves both provider and the patient.
Sure.
So we are constantly looking into patient's cost. So how do we reduce the patient cost? Because it's the main barrier for any access to healthcare, especially eye care. So when you're looking into the cost as a point, then you bring in a lot of ideas.
Yeah.
So one particular thing is kind of incrementally innovating to the existing model. So this is how we have been trying. Initially, we tried digital cameras, which are adapted to a slit lamp to capture images. And then we tried some modifications. And when we got low-cost cameras, now we are using these fundus on phone cameras to do this job. So one is kind of constantly looking at incremental innovations. The second is again looking at how we can exploit all these technology which is available, especially the information technology, mobile phones, and also the broadband connectivity now which is available in even rural areas. So to exploit this. And the third important tip which I would share is, I think we have to look into other industries for ideas. Sure. So wherever ideas are there, we have to bring it into healthcare and see how we can use it to effectively give kind of treatment to people who really need that.
Absolutely. Well, that's great. And we're really pleased that we can celebrate this win together, and congratulations on an amazing project with a great outcome.
Thank you.